It's a next generation RNAi company, and I'll give you a little more details about exactly how we are differentiated and what we are trying to achieve. At a very high level, we have a platform that we call CASi that stands for conditionally activated siRNAs. And this is a new class of siRNA, and I'll show you the structure of that. And there are a few key properties of this class of siRNAs, which is we find them that they're very good in terms of delivery and uptake into cells. They show very high potency and great duration of effect. And on top of that, we can design them to be cell selective. The technology comes from Caltech, but also Harvard and City of Hope. And it's a pretty broad platform, so we can apply to a broad range of diseases. To start with, we've decided to focus on primarily CNS indications, but we are starting to look at some systemic applications as well. The company has raised $52 million to date, and we have an excellent set of investors supporting us. We are now more than 20 employees and still growing. There's a quick introduction to the team and also to all the investors who are supporting us. So a little bit of my background, if that's helpful for this audience. So I co-founded Switch in about 2020, but prior to that, I was in business development roles at a company called 47 and also in Soma. And before that, I was in venture capital, worked at the Column Group. And I do have a Caltech connection here. I did my Ph.D. from Caltech, but maybe we'll cover some of that in the Q&A later. We have Craig Blanchett, who joined us as SVP of Research, and he comes from Genentech. And at Genentech, he was leading all of the platforms associated with oligos, gene therapy, all of the internal work that was going on at Genentech that was happening in his group. We recently brought in finance and operations expertise by hiring Mike Wolf. And Siping Han, and I'm sure we'll talk about Siping as well later in this conversation, is the co-founder and the chief technology officer, also comes from Caltech and was the lead inventor of this platform. We also have expertise in biology and medicinal chemistry with Don and Bob in the team. And they come from very deep expertise in neuroscience, drug discovery, and oligonucleotide manufacturing, both in big pharma, but also smaller companies. Our academic founders are listed here. Like I said, the technology comes from Caltech, and most of the work was done in Bill Goddard's lab, but also a lot of work was done in City of Hope, in John Rossi's group, and also a collaboration was done with Samir Das at Harvard. As you can see, we are supported by an excellent set of investors here, and we feel very fortunate to get that support. Our investors are a blend of traditional VCs, but also we have a lot of corporate VCs here. We have a lot of pharma companies who joined us pretty early on in our life. Actually, we have UCB Ventures, Ono Ventures, and also Lilly. Let me tell you a little bit about the technology. So this class of RNA that we are specializing in is called CASi, and the structure looks something like this. Most of the siRNAs are double-stranded, and when you think about antisense molecules, they're single-stranded. Our structure is actually a three-stranded complex. What you see on the right here is the siRNA, and what you see on the left is what we call a sensor strand, which is this long strand. The sensor strand and the siRNA side are kept together with this middle strand that's kind of looping through, and that's what we call a core strand. So essentially, this whole structure comes together into this complex structure, but it's manufactured as three separate strands, and it comes together. The siRNA is just like any other siRNA that's been used for a long time. The unique aspect is the sensor and really this whole structure that Siping Han, our lead inventor, invented over a period of time that he was at Caltech and also at City of Hope. If you look at the structure, the sensor has two regions. One is a single-stranded region, and the other one is a double-stranded region. I will go into how the structure really works in a cell. This is a very stable configuration, and this whole structure of three strands, they stay together till they actually enter into a cell. Once they're inside the cell, the way it's designed is that the sensor is supposed to sense RNA markers within the cell. And this is designed to be cell specific if we want it to be. For example, in the context of CNS, if you think about different cell types, you have microglia, astrocytes, different types of neurons. And let's say you wanted to just knock down a target only in microglia and not in the neurons and not in astrocytes. We designed the sensor strand to recognize RNA markers that are expressed only in microglia, but not in neurons or astrocytes or other cell types. So once the CASi is inside the cells and the CASi sensor strand identifies the RNA marker, it starts base pairing at the toehold, then it base pairs through the entire length of the sensor, and the sensor gets peeled off from the structure, and what gets released is an active siRNA. And that way we can design cell specificity into these molecules. What we find is that this platform is actually pretty versatile. One is what I talked about, we can design cell specificity, but if we don't want to, we don't have to. We can pick markers that are common across all cell types, and that way we can knock down a target in all cell types. What we also have found out is that this is very modular. So the left side, the sensor side, and the siRNA side, they don't need to be designed together. They can be designed separately, and they can be brought together. So it can be very much a plug and play. If you have a sensor that works for a cell type and you have multiple siRNAs you want to look at, we can just switch out the siRNAs without having to go through a lot of design. Also, the payload can be quite flexible. While we primarily have worked with siRNAs, but you can think about that being a small activating RNA or antisense or even microRNA. And in addition, we can be very compatible with other modes of delivery, whether it's packaging these molecules into lipid nanoparticles or AAVs or conjugating with peptides. All of that can be done with this structure. What I'll get into a little later is that we are also seeing very efficient uptake and activity, and I'll show you some data. In terms of applications, our primary area we want to focus on right now is CNS. We've started looking into systemic as well, based on some of very early data that we have in cardiovascular. But as such, the technology is very broad, and we think there are multiple applications across many therapeutic areas. I want to show you a little bit of data regarding our some activities that we've done in rodent models. This is what I'm showing you here is a mouse brain, and this is a mouse brain where we've injected CASi into the brain through ICV administration, which is directly into the brain in the ventricular space in the brain. And what we've shown here is that the CASi actually distributes very broadly, which you can see in pink here. It's labeled with a dye, and it distributes very broadly. And in the lower right picture, what you can see very clear pink dots, which means that it's actually getting uptaken into cells very, very well as well. And now the question was, okay, it gets in there, it's distributing well, does it actually have good activity? And here what I'm showing you is data from these studies. And what we did was we looked at multiple different brain regions, and you can see at the bottom the different brain regions labeled here. And we looked at the knockdown of a target at 14 days, 30 days, and 90 days after a single injection. At 14 days, we start seeing pretty deep knockdown across all brain regions. At 30 days, what we find is that that knockdown gets a little deeper. And at 90 days after a single injection, we continue to see very deep knockdown. So that's actually really important, because that means that as you think about advancing these into therapeutic molecules, we start thinking about what would be the frequency of dosing. And it seems to us that the frequency of dosing is not going to be burdensome for patients, because typically this class of molecules are being given through an intrathecal route of administration. When we think of CNS and we think about cell specificity, there are multiple cell types in the brain. While a lot of focus is on the neurons, there are other cell types that play a key role in a lot of CNS diseases, especially if you think about neurodegenerative diseases. Astrocytes, microglia, many of these they go into a different state, which could be a reactive state. And instead of having neuroprotective functions, those functions can convert to certain activities that's actually destructive for neurons and can lead to exacerbation of neurodegeneration. Those pathways are getting better and better understood, but those are also ubiquitous pathways. Many of them are important targets in these pathways that are essential for normal cells and normal cell functioning. So using an approach of generalized knockdown across all cell types would actually be pretty harmful. So our cell specificity approach actually allows us to create therapeutic windows for many of these targets, which otherwise would not be possible, but these targets which are known to be critical in many of these neurodegenerative diseases and the pathophysiology of many of these diseases. We at Switch, we have identified unique markers for multiple cell types in the CNS. As you can see, it's listed here. There are astrocytes, DRG neurons, endothelial cells, excitatory and inhibitory neurons, etc. We have a method by which we identify these markers, and we have a methodology by which we design sensors for these markers. And all of this is done through bioinformatics tools. This is just a simple example that I've put in here for our astrocytes. And we've identified multiple markers for astrocyte. And this is an example where we've picked one of them, which is marker 2. And the way we identify these markers is we look for what is the expression level in astrocytes. And here you can see by the size and the color of these circles here. In astrocytes, for example, these markers are expressed in high amounts. So you see larger circles. And you can see that the fraction of the total astrocytes in the brain that actually express it, that's given by the size. So the color shows the expression level, and the size shows the fraction of the total cell population that expresses the marker. We've taken marker 2 as an example here, and what we've done is a knockdown study in the presence and absence of the marker. So this is a CASi. In purple, what you see is the knockdown in the absence of the marker. And in orange, what you see is the knockdown of a target in the presence of the marker. And the shift that we see here is about a 25x shift in potency in the presence of the marker. What that means is that this should have a much, much greater knockdown of a target in an astrocyte versus others, because only astrocyte will have these markers. We have done similar studies in other cell types. This is an example of cardiovascular, where one of the major issues with heart failure is that the cardiomyocytes actually get larger in size, and left ventricular hypertrophy is very common in heart failure. It actually is one of the key signatures of heart failure and many heart diseases, but there really isn't any treatment to normalize the size of these cardiomyocytes. Calcineurin is a key molecule or key protein that plays a role in hypertrophy of cardiomyocytes. But calcineurin is present in a lot of different cells and plays a key role in many cell types. In fact, knocking down calcineurin causes kidney issues and also causes immune suppression. And calcineurin blockers are routinely used as immunosuppressants for transplantation. So the cardiovascular community has always been interested in a heart-specific calcineurin blocker, but that's been hard to find. Our co-founder from Harvard, who is a cardiologist, what he has observed is that in these cardiomyocytes, when they increase in size, there's a particular hormone that they produce called ANP, and the levels of those hormones actually shoots up significantly. And because levels of the hormone shoots up, that means the mRNA that's actually making this hormone, those levels actually go up a lot too. So what this shows is that in normal cardiomyocytes, you can look at the level of ANP expression, and then you can look at in hypertrophic cardiomyocytes, ANP level of expression goes up. So we created a CASi, which has the sensor was against the ANP sensor, the ANP marker for the mRNA for this particular hormone. And siRNA is just a regular calcineurin receptor. In our studies, when we treated primary cells with this particular CASi, what we found is that in hypertrophic cardiomyocytes, we saw a knockdown of calcineurin, whereas we did not see that knockdown in normal cardiomyocytes. Whereas if you were to just treat both types of cells with just the siRNA alone, we see knockdown in both hypertrophic and normal cardiomyocytes. We have a lot of plans regarding our platform and advancement of our technology, and we have raised our Series A, which is going to help us run through multiple value-driving inflection points. We plan to advance our first development candidate out of the CASi platform, and we continue to develop a very robust data package for cell specificity. We obviously are very excited about the investor base that we have. And again, we are also very interested in maximizing the potential of the CASi platform for collaborations with partners. So just to summarize, we are very excited about the next phase of Switch with this financing and as we advance the platform. Just to summarize what the platform is about, it is a modular platform where we can design cell specificity. We use bioinformatics very heavily to design our sensors and siRNAs. So far, our work has been primarily in CNS, and we see excellent distribution and potency. The foundation of Switch is going to be with CNS programs. However, we do see multiple opportunities in non-CNS areas as well, including cardiovascular and multiple other areas. We are also very well set up for manufacturing these molecules. It is kind of a new looking structure, although it's based on standard RNA manufacturing processes, but it is different. And it's very early on, we wanted to focus on making sure that these molecules can be manufactured. And with that, I'll turn it over back to David and Kevin.
No, thank you for that that explanation in terms of what you guys are doing. I think one of the things that I always find really interesting, and I think perhaps informative for our audience, is going back to the what I'll call the origin story for the company, and just where that came from, why in essence why do this. It can be a hard road, right? Like, so why did you had much success in your career, so this one was the one you wanted to kind of take and run on your own. So just some of that context, if you don't mind.
Sure, happy to. So just a little bit of background. I did my Ph.D. from Caltech, and I worked with Dee Datta at Caltech.
Yep.
So I did have a connection with the lab where this technology is coming from. I also worked with David Tyrrell and with Steve Mayo.
Yep.
So in terms of my career path after I did my PhD, I went into venture capital. I worked in business development roles in a few different companies. In my last role in Zoma, I was the chief business officer there, and we were working on a very interesting strategy, which is royalty monetization. But that's not about building companies. And I really felt that I wanted to build a company, which I really enjoyed doing as a venture capitalist, and also in my role at 47, where I was one of the early employees. And it was a great journey to advance that company to its next phase, raise Series B, and it went through an IPO and eventually got acquired. And I just wanted to find a technology that would have broad application and where we could go into areas where it's hard to go into otherwise. So, there are, if you ask pharma companies and scientists working in pharma companies, they often have a list of targets that they call undruggable targets. But it's not because of the biology. It's usually very well understood that why those are good targets. They have central role in these diseases. But it's really hard to go after them with many of the modalities that we have today, whether it's small molecules, antibodies, or even RNA knockdown with antisense siRNA. So I wanted to think about options that we could bring to patients that could be different. And with that mindset, I started looking at different technologies that are out there. And this really caught my attention because I started thinking about the breadth of the platform, but more than the breadth in different therapeutic areas, it's more about what could this platform do that other platforms cannot do, and how this could actually provide new options to patients. And with that in mind was how I started talking to Bill Goddard and Xipeng. And now Xipeng Han, who's the lead inventor, he actually graduated from Bill's lab. We didn't overlap, so I didn't know Xipeng. And when I was talking to Caltech, and I went to talk to Bill, and Bill invited Xipeng to give a presentation, and that's how we connected, and we started talking. And gradually we thought that, okay, there's some real opportunities here, and maybe we should start thinking seriously about how to put this together and raise some capital around it, do some key proof of concept work, and take it forward.
Yeah. Well, follow-up question on that. You've used the word platform a few times during this, and there's, maybe explain that a bit more, because the way that I think about the manifestation of that is like, with a platform, that's great, but you also want to prove specific things within that platform and earn the right to do others. So just how are you, how are you thinking about that? Because I can see the draw to try to do many things, and that's probably, strategically, how do you just, unpack all of the opportunities that are in front of you, and how to bring the first ones to market, but also maybe respect that platform optionality that's present?
Yeah, that's a really important consideration for us, and for, I think, most companies. The way we approached it was that when we started, there was limited set of data on the concept that this switching mechanism works, and a lot of that work was based on sort of proof of concept in vitro data. As we started thinking about different therapeutic areas, our our thought was that let's not try to do everything. Let's not try to create a data package which is a little bit of everything. Rather, let's pick one area and go a little deeper in that. And that's going to help us in putting together a much more robust data package that not only proves that in vivo this technology works, but we get information that's going to be relevant and can be applicable to other therapeutic areas as well. And with that in mind, we chose CNS, and that's where we decided to create the data package that eventually allowed us to raise our Series A. And that was our approach. But the way to expand the platform now, as we think about it, is that we expect expansion to happen, hopefully through more collaborations. Because internally, as a small company, as a startup, whether you're seed or Series A or Series B or Series C, chances are very low that you'll ever be able to or utilize the full potential of a platform like this.
Mm-hmm.
And what you can do is not think about, well, am I using it fully? Because you never will be able to. It's rather more like, can I maximize it? Are there other ways I can apply this platform through a collaboration or something else without losing focus on what are the key things that we need to do as a company to do it. So I guess the main thing is focus is really important. Pick a few areas and try to do them really well. When you're thinking about therapeutic areas, was our approach. And as we're thinking about our pipeline, it's the same approach that we're taking. Is that pick, even within CNS, pick a few disease areas and do really well in that, because it's complex. It's very complex. And as a small company, we are never going to have all the expertise and resources needed to look at everything, even within CNS. So I think that's one of the key messages that, we try to share within the company as well, is that it is a broad platform, but whatever you're doing, do a few things, but let's try to do it really well.
Mm-hmm. Yeah. Thank you. That makes sense.
So, David, I have a couple of questions, if I can jump in here. So, Dee, maybe you could just elaborate a little bit more on one of the other benefits of focusing initially on CNS and neurodegenerative disorders, which, as I understand it, is that, there are a lot of therapeutic candidates that have a lot of promise, but their ability to first penetrate the blood-brain barrier and achieve uptake, and then also achieve distribution anatomically, achieve and then hold potency in a durable fashion has been, a huge challenge to the entire pharmaceutical industry in trying to treat CNS disorders and neurodegenerative diseases. So maybe you could just unpack that a little bit more. I think it's an important part of your early strategy.
Absolutely, that's key. And you're right, it's been really hard to cross the blood-brain barrier, especially as you think about larger molecules like antibodies, systemic delivery of that, and expecting these molecules to cross the blood-brain barrier has always been a challenge. And the approach there has been to go into use modalities that are more invasive for the patient, which is more like ICD routes or other routes that are definitely more invasive for patients. But if you think about the modalities, small molecules, many of them do cross the blood-brain barrier. But for many targets, small molecules are not always the best solution, especially the CNS. So then you are looking at antibodies and looking at sort of knocking down a target at a genetic level. And that's when the route of administration becomes a bit of an issue, because you're trying to do an intrathecal route of delivery. And there, the potency and the duration becomes very important. So one of the things is that when you're giving a drug intrathecally, you want it to distribute across the brain very evenly, or at least get to the parts of the brain where the disease is being manifested. there are different neurodegenerative diseases their effects are more prominent in different regions of the brain. For example, if you look at Parkinson's, Huntington's, they are more deeper brain diseases versus ALS, which are more to do with the spinal cord, motor neurons, or Alzheimer's, which is primarily affecting the cortex or hippocampus. So the different brain regions, neurodegenerative diseases is not the entire brain all the time, evenly distributed diseases. There are different neurodegenerative diseases affecting different parts of the brain. So as you think about the drug reaching different parts of the brain, it becomes really important that you're able to get sufficient amount of the drug in the right place. It is potent and it has a long duration of effect because of the route of administration is invasive for patients. So those three things become important. And there's a lot of work happening in trying to develop technologies to cross the blood-brain barrier. And hopefully that will happen at some point because that's good for patients and that will really help. But so far, for certain classes of therapies like oligos, like gene therapy, even larger molecules like antibodies, it's generally hard to get anything across the brain without an intrathecal route of administration. So that was sort of our thinking as well, is that as we think about distribution in the brain of oligos, we wanted to pick an area where we felt that oligo distribution could actually work for that route of administration. So there are companies that have been working on antisense oligonucleotide for CNS for some time. And some of these molecules have gone into the clinic and recently one of them just got approved, the SOD1 drug for ALS by Biogen and Ionis. And so we are, as we picked the area and we thought of CNS, it was actually very reassuring to us that this area of oligonucleotide therapies have a potential in CNS, and some of these delivery issues may not really be big showstoppers for us. Right. And we kind of saw that early on. So as you're picking the therapeutic area, we also wanted to make sure that we de-risk it as much as possible. And somehow CNS was one of those. Additionally, I think the whole field of CNS is evolving so much in terms of understanding the different cell types and their roles in the different diseases. And that was another opportunity where our cell-specific targeting could be really leveraged to address these diseases.
Great, thank you. So I think to sort of summarize a little bit, this approach, this RNAi and CASi, holds a lot of promise for diseases that have been, to date, untreatable in some cases, where there's been very little progress to treat, even to just stop the progression, much less to cure or reverse the damage. So that's one of the things that I know caught my attention and David's attention when we first invested. The other thing that we found to be very impressive was your background and your experience, the Ph.D. from Caltech, a business degree, and a lot of experience on the scientific side of pharma and on the business side in a deal-making, research collaboration and M&A capacity. And I think, the evidence of that is, as we look across our portfolio, many of our life sciences, human health companies have strategic investors. You have three. One of whom is a household name in terms of pharmas in the United States, Lilly, and they've invested twice, and then UCB and Ono Pharma. So maybe you could just unpack that as well a little bit in terms of your background, your experience, and how, from our perspective, that's translated directly into a very powerful investor syndicate that has the potential both for research collaborations and downstream potential liquidity events and M&A, which is what strategics do. So let me stop there and ask you to comment on that.
Sure. No, we are really fortunate to have this amazing syndicate of investors, and because of that, we get really unique perspectives as well. I think one of the things that I would say is that the platform is really broad, and platform has very clear applications, right? And it's solving very clear problems. And that's not limited to any one pharma company. And why I say that is this was sort of one of the reasons why I was looking for a technology like this when I started, is that if you're looking at a very specific therapeutic area or a particular pathway, you're kind of limiting your universe of potential pharmas who might be interested, right? And that's fine. That's a strategy which is great.
Right.
That works, and they're huge successes. In that, in fact, one of my last companies, 47, was just focused on immuno-oncology and a very specific target, and the outcome and the exit was fantastic. However, what I wanted to do was not do that. I wanted to have something a little broader, but with a very clear value proposition, right? It's not about just, it's a great platform and it's very cool and the science is fantastic, which it is, but I just wanted to find something which it has all of those elements, but also something more where it's pretty clear when we would talk to pharma or investors that the value proposition was clear and how it could address any unmet need was also very clear. And I think that helped us in our conversations with pharmas, is that they clearly saw that there was a lot more to it than just exciting science. And they could very clearly see the path that how this technology could advance into therapeutic molecules. And that helped. And it's probably there for a lot of technologies, but I think for me, what I wanted to do was make sure that we highlighted those in our conversations with pharmas and investors early on.
You know, you closed your A round Q4 of last year, I believe it was. And you know, there's this narrative out there that, you know, money isn't flowing, and I was just curious, what do you think caused the success of that A round? You know, because you raised 50 plus million from like really good investors. You know, what's that environment out there right now like, and why do you think you were able to break through? Was it, I don't want to put words in your mouth, but just why do you think that you're able to pull that together for this opportunity in this moment in time?
Well, the environment, you're right, the environment is not very pleasant right now, and I'm hoping things will turn.
Right.
We all do, and it has to eventually.
Yeah.
Just timing.
Yep.
But I think what happened was that there was just a lot of momentum that was already built as we were having our conversations with farmers and with different investors. There was a fair amount of momentum that started getting built around our technology, and we started getting more data. I think in our industry, data is critical, right? So if you have good data, powerful data, and clear plans, I think that goes a long way, and that's what we focused on a lot. But also what did help is starting to get interest from a few different pharma groups. Actually, I think that definitely helped in this process to start, as investors started seeing that here's a company that's starting to get some early interest from pharma already. It's definitely pretty powerful, especially in this environment when, you know, cash isn't flowing, right? And people are much more careful about how they're investing. So getting that additional validation of pharma participation and interest was important, and I think that really helped.
Yeah. And how do you evaluate, you know, like, do you have an internal goal as to when you want to have the first, what I'll call monetization of the platform via perhaps a partnership, if you will, co-development or something like that. How do you think about wanting to retain that value yourself versus understanding that you may need to partner, and that might be the prudent thing, as you mentioned, for a startup to do, and even the timing of that now that you have, this war chest that you have, or, and I know it's probably, kind of, you can see the end of even that 50 million, but just how do you juggle all those considerations in a strategic plan for the company?
I think as a company, we've decided that we really want to obviously build our own pipeline. We want to have a few molecules that we advance and take into the clinic, and there are others that we will not, and we will do those through partnerships. While it's a platform, different platform companies have different business models, and some of them may not want to go into the clinic themselves and can just partner. Our strategy is that we do want to build our pipeline, and that's how we maintain some more value. But at the same time, we maximize the value through partnerships in non-core areas for us. So there are lots of therapeutic areas which we don't think we'll ever get into, but there could be very valuable targets there, which can be addressed with our technology, probably much better than maybe an antibody or small molecule. And I think our technology can be leveraged there through partnerships. So that would be sort of a strategy for us where we retain value, but also start maximizing or expanding on that.
Gotcha. Thank you.
So maybe another question that's just sort of a topical, relevant subject for business in general, which is the remote work versus, in your case, in the lab at the bench. So how has that sort of evolved since the pandemic started to wind down? And then there's also just a lot of press and a lot of drama around San Francisco and the flight, so to speak, from San Francisco. But David and I were just there last week. A number of our human health companies have, like you, set up shop in San Francisco. So maybe a few words in defense of the San Francisco Bay Area, since it's just taken such a beating in the press over the last couple of months.
So the first question about remote working, when you're starting a lab, it's really, remote working doesn't work for labs, right? You got to be there. Otherwise, experiments don't happen. So pretty much when we started, that's how we worked. And yes, we followed all the rules. If there was, any COVID outbreak or something, yes, we had to stop things and do what was the right thing to do for our employees and for ourselves and all of that. But in general, at least for our company, most of the employees are researchers, and most of them, they just have to work in the lab. That is the job, right? And for regarding San Francisco, this is where the talent base is. Right. Sure, there might be some people leaving San Francisco, but for us, that has not been an issue in terms of finding the right talent or anything like that. I don't see biotech getting hugely affected by it, or biotech disappearing from San Francisco or Bay Area, right? I mean, this is the heart of biotech. So there are always ups and downs, but I don't see it as a major issue in any way.
Yep. Question I have is on your team building, switching gears a little bit, related to the previous question, but just how have you chosen to build out the team? Maybe a little bit of a peek behind the curtain in terms of, a biotech company, just what are those critical first hires you're making? How are you sourcing those people? Because those are such critical people to trust and to collaborate with.
Yeah, to start with, we were very lucky that our co-founders, so if somebody has multiple co-founders, so Siping Han who is the lead inventor, joined the company as Chief Technology Officer. We have another co-founder named Lisa Scherer, who used to work in City of Hope in John Rossi's lab. And she also joined us full-time pretty much from day one. And I think that was huge for us, is that the people who actually invented the technology over years and knew how to do the science behind it were the ones who came in and set up the lab here. And soon after that, we started growing and adding more people. I think the strategy for our growth has been that let's hire for what we absolutely need and the skill sets that we are not necessarily duplicating. We obviously used a lot of outsourcing as well as a small company. There's a fair amount of outsourcing, especially as you're manufacturing. But very early on, we realized that the cycle times for manufacturing any oligos externally versus internally are so long that it was probably better just to make that investment for in-house. And that was a very strategic hire for us, is to start building our chemistry capabilities very early on, so that we can test these molecules really fast. And that was key, I think, to think about where can we save money and time outsourcing versus where can we save money and time by bringing in-house was a key factor in how we hired. And that became pretty obvious to us within probably the first 6 months of starting, is as we started working with different CROs, we realized that some are good, some approaches are good, and some are not. Some are just not going to be sustainable for us and give the turnaround we need. And that continues to be our approach as well, is to always assess this, that where are we getting speed and efficiency, because turnaround times in biological experiments can be long. And so if we can shorten those, and a lot of things do need to be repeated. I mean, when you're doing early stage discovery, you do an experiment and just single experimental data is usually not enough. You want to repeat it a few times. And having those ability to do that in-house becomes important. In terms of how we've recruited, I think we've used a mix of our own network, and also recruiters as necessary. But so far, I would say hiring has not been a problem for us, and we've been able to grow really well and excellent team now.
Yeah. Yep. Cool.
And Dee, what about things like machine learning, artificial intelligence, quantum computing, next generation analytics? Has that played a role in the work that's being done at Switch to date? And what do you see, if you sort of peek around the corner into the future, what do you see for those types of tools?
So far, I would say we haven't leveraged those as much for internal efforts. I think we're still a new company, so in terms of the amount of data that's generated, it's not bioinformatics data, but sort of experimental data. I think we're still new in our life science tech, so we are still collecting a lot of data to really apply any kind of algorithm tools to it. In terms of our bioinformatics capabilities, we certainly hope to apply some of those earlier in our process, in our evolution, versus maybe the or experimental side.
Do you see it playing a big role, I mean, in the future? Do you think there's ways that this might impact, maybe your capital, even your cost structure and how you approach the bench versus, in silico, if you will?
I think some of it will, as we expand into maybe new therapeutic areas, and we are going through a lot of databases to find unique markers and things like that. I could see that, especially if you're trying to patient level data from clinical trials and all of that. I can certainly see this playing an important role for us going forward. And I definitely can see this being pretty valuable, but probably not immediately for us, but maybe a couple of years down the road, this could play an important.
Gotcha. Thank you. Kevin, you have any other questions for Dee?
So beyond cardio, so beyond the CNS and sort of neurodegenerative, which I'm not sure if cardiovascular was really on the radar screen early on, or I just sort of I sort of missed that. But that's another huge area of unmet need. So has that sort of risen to the top of the list after CNS, above fibrosis and oncology, cancer, and so on, because you're having success there, or are the strategic investors starting to sort of influence which therapeutic areas you're pursuing, or how did sort of cardiovascular? I saw you had it sort of highlighted on your slide, it's a different color than the other therapeutic areas. So maybe just a little bit behind what's behind that.
I think it's just data. We've had some work going on in cardiovascular because of our co-founder from Harvard, who's a cardiologist. And some of this is work that was there even when the company was starting. So this is some of the early proof of concept work, and that's just continued to advance at Harvard, and we continue to do a little bit of work on that ourselves. I mean, our primary area is still CNS. And as we think about systemic, we think about cardiovascular as the next systemic for us, because of the data and the information we have already. And there are obviously a lot of others, but it would be a question of starting from scratch, de novo, a new therapeutic area. This is an area that was already in the works when we started.
Right.
I think that's the primary reason it has sort of it's being highlighted versus others, because there is work.
Sure, that makes sense.
Well, I don't have any other questions. Kevin, if you have any others, chime in.
No, this has been great. It's great to see the progress and spend some time with you today, Dee, and have you attend, participate, and lead one of our founder sessions. So thank you.
So thank you very much for inviting me to this. Really enjoyed the conversation. Thank you.
Yeah, and thanks to everyone who tuned in. Yeah, just thanks again, Dee, and hope everyone has a great rest of the week.
Bye-bye.
Thanks, Dee.
Bye.
Bye.
Bye.